we need to explore a bit more about what kind of physical activity they do. Modern housewives may not do a lot of work, and they might have maids or they might have machines to do all the the sweeping and the mopping and everything. So the traditional housewives, if I might call that way, they go knees and elbows to mop the floor, sweep. They do all the laundry, cooking, cleaning, and there is good evidence that such kind of household chores, they do burn a lot of calories, and evidence suggests, studies have shown they can burn up to 2,500 kilocalories in a week, and they can lose up to 1 kilogram in a month if they are consistent. So you'll have to explore a bit more. We cannot just dismiss telling, no, you're not doing enough and hence you need to do extra work. Housewife may not be able to balance exercise, cooking, cleaning, looking after the kids and family, and then go and join the gym or go for a long 1 hour walk. So if she's physically very active during the day and she's managed to do most of her household chores and she's doing them consistently, then I think we should consider that as a good physical exercise. But again, we should explore a bit more about how much they're able to do. Again, villagers, they do a lot of gardening as well, part of their farming and gardening as part of their household chores, which is considered as a very good exercise. So we need to explore what their lifestyle involves and what kind of physical activity or household chores that they are engaging in on a day-to-day basis.
Fear is the right word. That is usually the first response, whether the glucose levels are mild or very high. There is a sense of, in fact, the stages of grief are similar to stages of diagnosis of diabetes. It's sometimes a loss of identity. So all the 5 stages of grief are what we learn in managing their initial responses, initial emotions, especially for people who have very high glucose levels or very high HbA1c to begin with. They may have hard time accepting the diagnosis. They may have seen someone having a very bad prognosis later in life, and so there is a sense of feeling doomed, like I am definitely going to have that complication kind of a sense. So that needs to be allayed, that these complications can be prevented. It's a good opportunity that you have been diagnosed with diabetes. Take it as a predictive tool, take it as a power in your hand, that now that you know you have glucose levels high, you can reduce it and prevent complications. So when we counsel the patients, sometimes in a hurry, we can say that because you have high sugars, if you don't take care, you may develop complications. Rather than that, the message should be, if you reduce your glucose levels well, you will never get any complications. So we usually, whenever the patient comes for the first time, the counseling has to be that what we are looking at is how you're going to live a long and healthy life. That is the aim of all of this discussion, rather than focusing on the complications. It's about living longer, complication-free life. So I think lots can be done at the first visit itself.
And if we tell our ladies not to fast, they're not going to listen to us. So somewhere we'll have to work around helping them fast in a more healthier way and without inviting any hypoglycemia or a low sugar risk. So generally, if you look at fast, there will be somebody who's doing fasting only for a day, somebody who fasts for a week, and like months like Ramadan where they fast for the entire month, for almost from sunrise to sunset. Now each situation brings a different challenge. So for women who fast only for one day, and that too the simple fast where they're allowed to eat something, most of our women they end up eating what we call upwas farar, where if it's in the Hindi term, where farar is actually supposed to be falon ka ahar, means it's a fruit based diet which has to be there. But generally the simple fast, women tend to eat a lot of fried or carb rich food items. So for these, we would advise them, stick to complex carb based foods, stick to high protein foods like milk or curds or buttermilk or dry fruits and fruits. So these would be okay for somebody who's just fasting for a day and they're allowed to eat something. Then there are some fasts where they're not allowed to have even water. So for a diabetic woman, we tell them to skip the morning dose of medications. Luckily, we have new medications today which are available for our diabetic patients, where they can be controlled only with one single dose in the night, which they can take it after they break their fast. And that would prevent them from having a low sugar episode. The other fast would be the week-long or the month-long fast. So we just had the giant Paryushan which went by, or the Ramzan month of fasting, holy month of Ramzan, where they are fasting for days together. Now, again, in these patients, we tell them to get their sugars sorted before they get into the fasting mode. We can change the medications. We take off their morning medications and we put them on one medication in the night. So the few factors is monitoring the blood sugars. So women who are going to be fasting for prolonged periods, they need to be monitoring the sugars on the glucometer regularly so that we prevent a low sugar episode to happen. Exercises also could be restricted during these periods, and hydration whenever they break their fast should be emphasized. So we don't say no to complete fasting today. We allow them to come under control, tweak their medicines a little bit and allow them to fast. But of course, all this is only for type 2 diabetic patients who are not on insulin. So type 1 diabetic patients are deterred from fasting. It's not advisable for them because they're going to be landing up with diabetic ketoacidosis or hypoglycemia if they take their insulin and they don't eat something. Also, for type 2 diabetic patients who are on insulin, we again advise to refrain from fasting.
Surgery is a very important thing in patients with diabetes because there are two types of surgeries. One is elective and the other is emergency surgery. And diabetes, when it's uncontrolled, people with diabetes are more likely to develop complications during surgery and after surgery as well, because again, uncontrolled diabetes results in delayed closure of the wound and infection around the surgical site. So we don't want any patient with uncontrolled diabetes to undergo surgery. But at the other end, people can have very emergency surgery. In that way, we tend to optimize the sugars, the glucose levels as early as possible. But sometimes there's not enough time. In that time, we tend to manage the glycemic levels during surgery and after surgery. But most patients who want to have an elective surgery, there is something known as a HbA1c, which is a marker of glycemic control over the last 3 months. For most patients who wants to have elective surgery at their leisure, we advise them to wait until the HbA1c comes to less than 8. So that's the guidelines that recommend. And people with diabetes, they are more likely to have hypoglycemia because of inappropriate dosing schedule, hyperglycemia and hypoglycemia, intraoperative, preoperative and postoperative. So definitely a person with diabetes who is undergoing surgery should require the care of an endocrinologist. And the treatment changes mostly people need to be shifted from their oral tablets to insulin around the time of surgery. So this is the thing where endocrinologists are the go-to persons for diabetes management in and around the time of surgery. So surgery is a special thing for patients with diabetes. So tables can turn very quickly with surgery, because surgery is itself a period of stress and the patient might or might not be eating well. So this is a very complex thing.
The fluctuations in diabetes, as a lot of data suggests now, there is some concept called time in range and inter-day variabilities, where they look at the day-to-day variability or R2R variability on the CGM, which is put on your hand. It is suggested that, if you have a lot of fluctuations, the ups and troughs and peaks which come in your glucose, peaks and troughs which are coming in the day, might actually cause a lot of complications. So these peaks which are coming or the intraday variability can lead to a lot of complications in diabetes, which we have been discussing for a long time. So how do you avoid these complications is proper meal timing, rather than a lot of people snack in between, and also your correct monitoring your diabetes well, not frequent snacking, not gulping. Have a proper proteinaceous food, low carb, and keep your timing of food regular. So that's what is very, very important, because erratic food patterns. Now, someone I have from the IT sector might just have a night shift. He would just get up at around late evening and start taking food, and then would have a extended release of fast, or he might gulp down. So it depends on patient to patient. How do you monitor? How do you keep these fluctuations in check?
It is important that all of us know that the most important aspect of preventing complications is good glycemic control or good control of blood glucose levels. So, but we can say that there is a certain percentage of people who will have some complications that occur even at the diagnosis itself. So that may be around 10 to 15% of the patients may come directly with the complications and the diagnosis of diabetes simultaneously. So that is the only group of people where we may not be able to prevent the first impact of the diabetes on their body. But we can always prevent the further deterioration of the problem. So we may have a minor neuropathy which can be managed immediately, and then we can control the blood glucose level and improve it. The patient may have some heart ailment, and then he does good glycemic control, manages his blood pressure and cholesterol level, and they may prevent further damage of the heart. And in the same way, taking care of the feet and regular checkups of the eyes can result in preventing the complications. And in those who have already developed minor complications, we can definitely prevent the progression of those complications in them.
Yeah.
So definitely 90% of the people, we can definitely prevent most of the complications. And if not prevent, in some people, we can delay the impact of the complications on their overall lifestyle or their lifespan, because it is said that uncontrolled diabetes reduces the lifespan by almost 8 years. So good glycemic control with management of the blood pressure, cholesterol levels with regular check can actually increase the lifespan by 8 years if they are able to do that in communication with their own doctors, and also take care of the stress through interaction of the family and their workplace. All these measures can definitely prevent and delay the complications.
This is the era of fad diets. I wish to talk about three of them. The most proved one is the intermittent fasting, where medical journals are also sometimes commending them. Now, what happens in intermittent fasting is it's what is known as a 16-8 formula.
Yeah.
That is 16 hours of fasting, and 8 hours, maybe between 9 a.m. to 5 p.m., maybe 10 a.m. to 6 p.m., you eat at that particular time. So this is said to be the way to go about it. But this has its own pros and cons. If you see the pros, intermittent fasting definitely can help the obese adult to lose weight. And in one study, people with obesity and type 2 diabetes lost much more weight by intermittent fasting rather than by restriction of calories. Regarding the metabolic parameters, it improves the glycemic control, it reduces the fasting sugar, and if a patient is on insulin, sometimes using intermittent fasting has helped us to go off insulin also.
Okay.
And even the lipid profile improves, the triglycerides reduce, there is more HDL formation, etc. And remember, we are talking about the metabolically dangerous abdominal fat. That also can reduce to some extent. Now, regarding the cons, it is probably, especially people with taking insulin and all, should avoid it, because and more powerful drugs like sulfonylureas, they have to be very careful, because hypoglycemia is a possibility. Nowadays, of course, we have these devices like the CGMS, that is the continuous glucose monitoring. Probably it's a good idea for them to wear this so that they are aware of these hypoglycemic potentials. It can also affect the circadian rhythm.
Right.
Now, coming to the ketogenic diet, actually, you see, ask me, the enthusiasm is exceeding the evidence. What exactly happens is these people who follow ketogenic diet are encouraged to forego carbs and consume fat up to 70% of their calories. And because the waste product of fat is ketone, so you generate a lot of ketones in your body, and hence it's called ketogenic diet.
This is very common problem in obese patients, where we see that these patients suffer from depression, anxiety, behavioral problems, and therefore in such patients, simply advising them about diet and exercise won't help.
Yeah.
We need to have regular counseling in the form of behavioral therapy. We should advise them to follow regularly, and we should do their counseling more frequently. And we should encourage, even if they lose 1 or 2 kg weight, they should be rewarded, and they should talk more frequently, so that that depression, we can help them to overcome the depression. We should also advise them to do certain meditations and yogas, which will help them to reduce the depression. They need to advise to, we need to talk their family members as well, so that they will also help them to overcome this depression because of obesity. Sometimes, if these patients are not responding to just lifestyle modification, we may have to give anti-obesity agents along with anti-diabetic agents like SGLT2 inhibitors and GLP-1 analogs. And if these patients don't respond, sometimes we may need to give antipsychotic therapy also in consultation with the psychiatrist. So these are the step-by-step approach which we should follow in this patient to overcome the depression, which is very common in obese patients, which will not affect their professional and family life.
Bariatric surgery now is considered to be a metabolic surgery also by lots of bariatric surgeons and medical societies also.
Okay.
It's not the first option. Let me be very frank with our viewers. People want a shortcuts. Let us do the surgery and then my all diseases will go away. Why I want to do a lifestyle modifications and take the medications, do exercise and lose weight and wait for a year or two. It will be done with a surgery and everything would be fine. So normally, first and foremost, let patient try with the lifestyle modifications. Let them have the realistic goal about their weight loss. And now lots of anti-diabetic medications now approved for the obesity also, even if somebody is not having a diabetes, like GLP-1 receptor agonist, and some of the diabetic medication like SGLT2 inhibitor also helps to lose weight. So anybody who starts losing weight, that boosts their confidence that, okay, I'm able to do it. And every time you keep on motivating them, okay, fine, this month you have not lost, don't worry. Because the demotivation is the main reason people stop losing weight or making any efforts to lose weight. So if all these efforts fails, like lots of mechanical problems, not able to walk at all, lots of cardiac problem, very uncontrolled diabetes, hypertension because of the morbid obesity, after all the efforts fails, with understanding that this is not the end of the story. People consider metabolic surgery like everything will be cured. There are now lots and lots reports about metabolic surgeries or bariatric surgeries performed for now almost 1.5 to 2 decades globally, more compared to India. Now there are lots of weight regain occurring after the bariatric surgery, some pancreatic problem occurring after the bariatric surgery, some stones are occurring after the surgery. Couple of my patients have done a suicide actually after bariatric surgery because they have lost weight but they are not able to eat because the stomach is restricted. So their desire to have food has gone. Is there, but they are not able to eat. So lots of psychological counsel, nutritional understanding post-bariatric surgery, and tell them that unless you follow a healthy diet, your risk of getting other metabolic complications would be less, but it will be definitely there. So people have started gaining weight, blood sugar has started coming back. So for what purpose bariatric surgery is being done? Many times 10 years of diabetes who is just little bit of overweight wants to get a bariatric surgery because somebody on the net has written, hey, after bariatric surgery my diabetes has gone. So what is the purpose of a bariatric surgery? It's just a weight loss. It is the insulin which you want to reduce or stop, or anti-diabetic medication to be stopped. So that all goals should be in the mind of the patient, and they should understand that this is not the end. This is just a one step, and subsequently you have to follow the healthy diet. You can take little bit of liberty, but you cannot have an unhealthy diet, because ultimately it's a cosmetic medical problem is temporarily gone. But which type of bariatric surgery again is a very important. It's just a cutting or a slicing of the stomach part. Lots of people will regain the weight. The bypass surgery with the restrictive surgery would have a more weight loss and less chance of weight gain. So which type of the surgery, for what purpose, patients should understand, and then we should advise. And subsequently, because they are not on many of them don't require anti-diabetic medication or anti-hypertension medication, so they come back after 5 or 7 years. We get again blood sugar coming back, blood pressure coming back. So they should be told that they should be under medical follow-up. Even if they feel okay, their weight is not regained, they have to come back at least once in initially 3 months or 6 months subsequently, to make sure that everything is fine, like the nutritional aspects and metabolic aspects is taken care.
I would give one mantra: practice mindfulness. Whether you are eating, whether you are sleeping, whether it's stress, just be aware on what you are doing to the body. So that, and invest in your body and your health, and you'll get better returns in the future.
Maybe eat right, do right set of exercises as suggested by your doctor, and also take right set of medications.
It has to be motivation, discipline, and persistence. So first of all, you need to understand it's your health. You need to be motivated. Nobody else, no health talks, no influencer can do anything unless you yourself understand it. And this is a disease where you require discipline. And even if you're disciplined, we try out lifestyle changes in a way where you can stick to. So
sustainability is very important.
You Josh and do everything and lose 10 kgs of weight, and you leave it and you again have a rebound of 15 kgs back. So that is not the way to do it. So motivation, discipline, and persistence. So these are the keys to not only deal with diabetes, but again any long-term metabolic health issues.